Did you already press it in the YouTube? The blue button.
So we are live. So I've been saying this every time, right? We are live. So May 7th, today is our Bariatric Friday day. So this is American Surgery Center Bariatric Surgery Program. My name is Kemal Erkan. I'm here with Dr. Isaias Irgau. I'm the chairman of the group, and Dr. Irgau, if you can please introduce yourself, and then we'll start our session right after that.
Thank you, Kemal. Welcome everybody to Bariatric Friday. I am Dr. Irgau. I am the president of CHRIAS, or the Christiana Institute of Advanced Surgery. My specialty is weight loss surgery, and I have been performing weight loss surgery now for almost 20 years. Along with my colleagues at CHRIAS, we are by far the most experienced group when it comes to providing bariatric surgery. So thank you for having me, Kemal.
Thank you, Dr. Irgau. So I do want to actually introduce our other surgeons as well. So this program is, I think, one of the most productive bariatric program in the country in terms of our live sessions as well, because at least once a week we go live, and then about 4 times we have webinar events with our partnership with one of our other institutions. And I do want to introduce our team. Everyone knows Dr. Irgau already. Dr. Gail Wynn, one of the most experienced female surgeon in the country. Dr. Mike Peters, Dr. Rahul Singh, and Dr. George Ibrahim. They are on the bariatric side. And then we have Dr. Sachin Vaid as our colorectal surgeon, and he's an essential part of our team. We also have our nutritionists, dietitianists who are part of this program, and they are there to support our patients. Fran, Amy, and Beth, they're wonderful to support our people, and that's what we are. That's who we are. So our program, with all surgeons that we have done more than 10,000 bariatric surgeries. Obviously, we do also general surgeries, but our specialty is bariatric. So our, in terms of our certifications, accreditations, so what I want to actually emphasize here is we MBCA QIP. There are only 10 surgery centers, and I do have to take a different pride from that, because there's only 10 out of 9,300 surgery centers in the United States. Blue Distinction Center Plus, this is again very unique, and for Aetna Institute of Quality, we were able to obtain all these in a very as quickly as possible, actually, as quickly as humanly possible. But we were able to actually get them. So, and that's what we are able to do. Now, Dr. Irgau, one of the things that I wanted to ask you is, well, you are a general surgeon from training, so then you decide to go into the bariatric, and our topic today is not this, but I just want to ask you, and since you are actually kind of casual today, so I was just telling him today that you look like a teenager. So tell us why you actually specialize in bariatric surgery.
Absolutely. So it's interesting, Kemal, because if you ask the younger surgeons nowadays, they will tell you that they have seen their mentors do bariatric surgery. So throughout the last 20 years, as we were performing bariatric surgery, we have trained many surgeons, and some of them are actually practicing in our area as well. And these are surgeons who have watched us do bariatric surgery and fell in love with bariatric surgery through their observations and their training when we were performing it. When I was training, there was no bariatric surgeon, Kemal. So it was an unknown entity from that point of view. So my entry into bariatric surgery, as I said, is serendipitous. I was always interested in what's called minimally invasive surgery. So as we were training, whenever we did operations, Kemal, and we wanted to enter a body cavity to do a procedure like gallbladder surgery, appendix surgery, stomach surgery, we would make a big incision. We would put all our hands inside the abdomen and do the surgery with our hands. This was a very invasive surgery, but that's how surgery has been done for many, many years before our times. But as I was finishing training, something called laparoscopy came into view. And laparoscopy means essentially making small incisions to enter the abdomen and do surgeries really through small incisions. And the most common surgery that we did when I was training was gallbladder surgery. Gallbladder surgery, all my mentors, all the surgeons that were training me, that's the most they could do, right? But I always wanted to do even more complex procedures through laparoscopy. That's something that I really wanted to. And interestingly, very early when I started practice, I went to a conference where actually I saw a surgeon perform gastric bypass laparoscopically. He was making small incisions and do this complex procedure. So I absolutely wanted to do that. I loved that operation, and I straight away actually enlisted the help of one of my colleagues, Dr. Wynn, who later became my associate in practice. I told her, hey, let's go and train on this surgery. It's really a cool procedure. So what I wanted to do was that procedure. I had no idea why that procedure was being performed. But that procedure introduced me to the reason they were doing gastric bypass, which is bariatric surgery. And as I learned about the procedure, I also learned about bariatric surgery. And as I started gravitating more and more toward bariatric surgery, what I have discovered, Kemal, is that I was providing treatment to resolve many medical problems, right? I was trained to do one surgery for one disease, right? Somebody comes with a diseased gallbladder, do surgery, take it away, and you fix that. But you haven't touched their high blood pressure, you haven't touched their diabetes, you haven't touched any other of their health problems. But when I discovered bariatric surgery is you do this operation, you help people lose tremendous amount of weight, and guess what? They become very healthy in many other aspects as well. If they had severe headaches, they disappear. If they had joint pain and arthritis, that becomes a lot better. If they had diabetes, that goes away or becomes better. The same with high blood pressure, the same with sleep apnea, the same with many other illnesses. So I discovered a procedure, a surgical treatment that could offer a new life to patients. One of my favorite stories, Kemal, is one of my early patients who, after losing weight after bariatric surgery, came to my office asking me to take him off disability so he can go back to work. That, to me, that was just a wonderful thing to see somebody who was on disability because of their weight, right? Now they've lost weight, they're able to go back to become a productive citizen. And that was a wonderful thing to watch and see. So my introduction to bariatric surgery was through the surgery itself, but then the field itself, obviously caught me. And I have been doing bariatric surgery now since, as I said, for the last almost 20 years. I have trained many other surgeons with that and built with my associates one of the most experienced bariatric surgery groups in the area.
So, Dr. Irgau, those are the times actually where obesity is not recognized as a chronic illness. And I remember when I started working with you in 2003, so it's about 18 years ago,
yeah.
We were struggling to get these procedures accepted by the insurance companies. And today we are in a really different situation where we are able to do these surgeries as an outpatient surgery, which is a big accomplishment, and we are able to do them safely, obviously. So now, Dr. Irgau, I just want to go back to our topic for today. So now what we are doing in these sessions, we are actually dividing these topics into small sections so that it's easier to digest. So what to expect on the day of your surgery, types of bariatric surgery, overview of the bariatric process, maintaining weight after surgery, and who are candidates for the outpatient surgery. Now, today our topic is on multivitamin use before and after weight loss surgery. So now, everyone by now knows the qualifications, 18 and over, you're at least 100 pounds overweight, and your BMI is 40 or greater, or if it's between 35 and 40, you need to have one of the illnesses in terms of diabetes, high blood pressure, heart disease, and sleep apnea. So, and we are able to help many of our patients with these situations. But today, multivitamin use, now, if you can tell us, Dr. Irgau, why this is important, what happens when we don't do it, when we do it, before and after, how actually that's important, and what we can do to help them.
Absolutely. So first of all, let us introduce the issue of vitamins in general. So what are vitamins? Vitamins really are essential, what we call micronutrients that we all need to stay healthy, right? In the past, we remember his stories of sailors developing scurvy because they would be in the sea for a long period of time. They wouldn't have access to fresh fruits and they wouldn't have vitamin C. So they would develop those diseases like scurvy, right? So we know vitamins are necessary. In fact, vitamin means vita, in Latin means life. So these things are essential for life, right? Now, of course, if we have access to fresh food that comes right from where nature made it, actually, we would have enough of those nutrients in our diet. But we live in a modern society, Kemal, where we don't have access to fresh food, right? The vast majority of the food that we get access to is food that is at least some days old, that is processed. So there is not enough of those nutrients. And it's essential for us, all of us, regardless whether we've had bariatric surgery or not, living in this society, we must take multivitamins. We must take additional of these micronutrients. Now, when you introduce bariatric surgery, what you are doing is essentially you're making changes to the digestive tract. All types of bariatric surgeries essentially mean there are changes in the way our digestive tract works or functions, right? What does this result in? Invariably, the amount of food the person takes in is a lot smaller, either because the surgery makes them eat less, or in addition, the surgery allows their digestive system to absorb less of those nutrients. Well, in a way, that's our goal. We want the person to eat less. We want the person to take in less calories, right? But the other side of this coin is that when we are decreasing their intake, we are also affecting the vitamin content of their food. So if they were not taking enough vitamins by living in a society where there is no access to fresh food, after bariatric surgery, that problem becomes even more acute. So after bariatric surgery, we are keenly aware of the need for vitamins, and we recommend vitamins for all of our patients. Now, depending on the type of surgery that we do, this problem is more or less acute. For instance, if we take a procedure like the gastric band, where we do really only a fairly restrictive procedure, the need for vitamins is not as great as it is, for instance, with gastric bypass, where not only we're making the stomach small, but also we are rerouting the intestine, so the ability of the digestive tract to extract those vitamins from the food is greatly diminished. So there is greater danger for vitamin deficiency with a procedure like gastric bypass as opposed to the gastric band, and the gastric sleeve falls somewhere in between. So issue of vitamin deficiency is critical for us. Of course, if a person doesn't take enough vitamins or they become deficient, there is a risk of weakening of their bones, there is a risk of hair loss, there is the risk of poor healing of wounds, and also potentially nerve damage as well. All these problems can be completely averted or prevented by taking adequate vitamins. So what we do is, when we teach patients about life after bariatric surgery, in fact, what our dietitians, Amy, Beth, and Fran do, part of the education is actually to teach patients about vitamins, and they show them what kind of products may be better suited for them. And this is the learning process that our patients will go through. And after surgery, obviously, they will take their vitamins regularly, as well as having healthy diets. Now, we cannot rely only on the education of our patients for us to know that they're taking it. What we do as part of our follow-up, Kemal, is we actually do blood tests periodically, right? For instance, at the 6 months, we will be doing blood tests. Every year, we'll be doing blood tests, and those blood tests include checking vitamin levels as well. So if a patient is lacking on a particular vitamin, for instance, very often we see patients lacking vitamin D, then we can prescribe extra strength of those vitamins for the patients to take in. So in essence, the issue of multivitamins is critical for our health in our society in general, but it is even more critical after bariatric surgery. So bariatric surgeons and bariatric programs like ours pay great attention to the issue of multivitamins, both in educating the patients, getting them access, but also testing afterwards to make sure they don't become deficient on those essential micronutrients.
So, Dr. Irgau, it's interesting I'm trying to kind of like, although I do the case conferences every day, in these sessions, I try to put myself in the patient's position to understand these a little bit better from the clinical side. Now, although this sounds like if it's something happening with them after the surgery, that's happening because that's the goal of losing the weight, and because that's happening because we eat less. So then the surgery actually is doing what it's supposed to be doing. It's not like a side effect, right? This is kind of important because as I'm listening, I feel like why would I want to deal with this issue, right? That's because this is not our main issue. Our main issue is 100 pounds. Like today I had a patient in the case conference, and the patient was 448 pounds. BMI was 74.4, if I'm not mistaken, 448 pounds. And for those who are watching us outside of United States, that's about 207 kilograms. I'm 92 kilograms for those who are just kind of, like it's not my height, this patient, so it's at least 12 inches shorter than me and more than double my weight. So for that patient, the goal is to lose weight, right? So, and yes, how are you gonna lose weight by eating less? So this is why it's important to understand what this vitamin does. It's not like something, it's almost like a side effect, but it's not. It is the supporting, to make it substantiating the longevity of what we do so that you are not suffering from any of these issues. Is that kind of like, I'm trying to kind of simplify this from the patient, since I'm the patient in this setting. So is that the right assumption, Dr. Irgau?
Absolutely, absolutely, Kemal. There is no question about that. So this is something that is enhanced because of the surgery, right? The access to vitamins is essential as it is, right? But when we have surgery, particularly bariatric surgery, the changes in our digestive tract will make this issue even more acute. That's why you pay a lot of attention. It's interesting that you mentioned the word longevity, Kemal. Well, just this week, actually, a very important paper was published in Lancet, which is one of the larger medical journals in the United Kingdom, where researchers have looked into 175,000 patients and looked at the ones who had bariatric surgery and the ones who didn't, all suffering from obesity. And they clearly demonstrated that once patients have bariatric surgery, they live longer. They live longer, there's no question. So yes, they will need to take more vitamins. Yes, they have to pay attention to their nutrition, but so does everybody. We should all be paying attention to those issues, particularly when we live in a society where we don't have access to fresh nutrients. Come on, we have to pay attention to those. So as part, and in a way, Kemal, the idea of having a program around bariatric surgery has to do with these issues as well. Can you imagine, Kemal, if bariatric surgery was done just as other surgery, where somebody says, hey, Dr. Irgau, I know you do sleeve gastrectomy. Can you book me for a sleeve gastrectomy next week, so that I can lose 100 pounds? I do the surgery and that person disappears. That would not be a good thing, right? Because we have to have a program that really, really educates that patient about what they have to do in the future, not only to make sure they keep their weight off, but also to stay healthy from the requirement of all these nutritionists point of view, so that I can teach them about this. I can get people like Beth, Fran, and Amy helping me educate those patients. but also I can provide them access to their vitamins, and then I can check the levels of the vitamins afterwards. That's why you need a program. This should not be a surgery that is done on the fly, right, Kemal? On the go. This is a surgery that should be done with a program, and that's why we are extremely happy with what we do between CHRIAS and the American Surgery Center, is because we are anchored around a solid program that is essentially designed to do that. That's why it was accredited so quickly by those accreditation bodies, because they saw we had a program in place. We were not just here to do the surgery, we were here to make people healthy by educating them and preparing them well, right? Getting them through the surgery safely, and then following them afterwards through their journey as well to make sure they stay safe.
So, Dr. Irgau, I think one of the really important part of this, just to understand the morbid obesity and understanding that this is a chronic illness. So it's not an acute problem. So when I say acute problem versus chronic, if you don't mind just very briefly just telling us what's acute versus what's chronic. And then I just want to come back to that with a couple of my comments.
Absolutely. So when we talk about an acute problem, Kemal, is an acute illness, right? It could be a febrile illness, it could be an infection, it could be an inflammation, right? The most common acute problem that I see as a surgeon, one of the most common is, for instance, is gallbladder problem or appendicitis, right? Where the appendix becomes inflamed or infected. So that's an acute problem. A person was relatively healthy or in their usual state of health, right? Then one day they develop pain. Then we make a diagnosis. We take them to surgery. We take that diseased organ out. They become healthy or back to their usual state of health. And then we discharge them, right? With morbid obesity, we are dealing, as you correctly said, with a chronic problem that has a slow, gradual onset and evolution, right? And then it starts in a pervasive way, affecting all organ systems and creates disease almost in every organ system, right? That's the chronicity of it. Now, we do surgery to fix one issue, which is change the digestive tract so that person starts processing food and change their metabolism so they can start using the fat for their energy, and therefore they start losing weight. The fat that creates the disease state disappears and that person gets better. However, the reasons that person became heavy in the first place have to do with their biology. So there is still a potential for them to go back to that chronic situation unless we follow them and unless we walk with them. And that's why morbid obesity, as we have been fighting for years, has been recognized as an illness, as a chronic illness that requires chronic management. And the surgery is just one part of that intervention.
So the reason I wanted us to kind of just explain that, so because it's chronic, just like the patients with diabetes, they live with medication for their entire life. And while we are going through this process until we adopt certain things long-term, it's not going to be disappearing, right? So we'll just get the overweight part of it out. So that's going to make it less complicated for all the other illnesses that we may be having. And also, as we said earlier, patients' well-being for long-term. Like if this patient, instead of until 65, if they can live until 78 because they lost extra 80, 100 pounds. And this is factual, this happens. So that's why we are actually kind of highlighting any of these things. Many people take multivitamin anyway, right, Dr. Irgau? So
yes.
Like people who don't have any of these problems, and then if they are just working out and do other stuff, they do it just to make those things more efficiently. So this is not something that only bariatric patients are going through. I mean, everyone is trying to do something better for their lives. Now, I do want to mention a couple other things. After doing a couple of sessions on the hospital issues that we have with the hospital systems, especially in Delaware, patient satisfaction score is extremely important. And once I realized how important our number and our achievement is, And we are right now at 99.3% satisfaction rate. And this is, if you guys remember from our other sessions, the hospitals are in the high 60s or low 70s in Delaware. So this is a hospital from the surgical point, and we are almost at 100%. And we can't, we can't really appreciate enough for our nurses. And as I mentioned, our nurses today, this week is the Nurses Week, and I do want to celebrate their Nurses Week. And this is the Nurses Month, so we'll mention this in the next couple of sessions. And I do want to thank them, each of them, because it's extremely important for us to reach to these. Now, patient satisfaction is important, but understanding what we get from these, and Dr. Irgau and myself, what we have to really do to get to the bottom of some of these issues, understanding what patients are struggling is, like, why are they not able to show up for an appointment or a lab work? So today, I'm going to actually just bring this up. One of our patients that I talked to last week or early this week, I was, Dr. Irgau, I was kind of like, maybe a little bit, no, I wasn't upset, obviously, but I was just, because we called 7-8 times, I said, why are you not getting your blood work done? Or it was a pulmonary follow-up, a sleep study. And then she says, Uber is too expensive. I'm like, oh, so like you have, like, you can use transportation. No, she doesn't have transportation. And what we know is we have insurance companies, they do provide, now I'm going to actually speak to our Medicaid population between health options and MaryHealth. So they do have medical transportation service available for non-emergencies. So there are phone lines. So this is through state of Delaware Medicaid. Here's the number. So you can actually call this number here and make sure that you can get, you can schedule transportation if that's needed. And this is the line that you should be calling here. So they are saying that no less than 3 days in advance, schedule appointment. So this is a wonderful service. So as we may be criticizing our state government and the federal government in some cases, when we see the services, and if it's done efficiently for our patients, obviously we are going to recognize those as well. So our patients can go to the Medicaid website and call that number and schedule their transportation. This is a great service. Now, one last thing before we go, we mentioned last week the telemedicine. For best telemedicine experience, I need every patient to activate their IQ Health. This is our patient portal. It's efficient, extremely easy to use, and its access is power. Our patients' access is power. This gives you access to your chart, and you own your chart. And then if you don't have access to something you own, there is no meaning to that. So this makes it more meaningful. And then while you are doing the telemedicine with us, private environment, test your technical setup, remove distractions, and have necessary information ready. These are going to be really important. We have our set events now, Bariatric Fridays, every Friday at 1 p.m. The weight loss webinars on second and fourth Tuesday at 6 p.m. We have United Medical ACO recent events updates. That's Friday at 12 noon, right before this one. And Wednesday wellness webinars. This is done by our dietitians. This is every second and fourth Wednesday at 7 p.m. One other private event that we have is our event for support group. And that is happening for those patients who have bariatric surgery through CHRIAS. They will be able to join us first Tuesday of every month at 6 p.m. So that's what we have for today. Dr. Irgau, anything you would like to add before we close?
I would also like to say Happy Nurses Week, Kemal, nurses out there. Happy Nurses Weekend. Thank you.
Absolutely. Well, thank you so much, Dr. for joining me, and we'll be back next week, same time. And until then, please stay safe.